AM 1220, KHTS, hometownstation.com. I am T here for the next hour with Dr. Proctor. This is an opportunity for you and I to peek over the shoulders of medical professionals to kind of see what it is they're doing, what it is they're thinking about, and take a little bit of the mystery out of exactly what is going on with our well-being and the well-being of the people we love. As the population, for the most part, is wanting to be more and more an advocate for their own health, trying to be healthier or even get healthy from ground zero, this is a chance for us to have conversations about what we can do to that end and what are the new things that are coming down the pipeline in the medical profession, et cetera. For example, today I have with me Dr. Michael Farzam, who is a board-certified physician, and he is part of a company called House Call Doctor Los Angeles. If you've not thought for a million years that you could have the doctor come to your house, things have changed. Things have changed a lot to where a lot of times, personally, I know I've sat in the middle of a waiting room thinking, I don't know, all those people are sick. I have a grandmother who used to say, I'm not going to the doctor's office because that's where the sick people are. I don't want to go to the doctor's office. I don't want to go to the hospital. There's a lot of truth to that. And if there are times when, you know what, you're just not feeling well enough, you're feeling kind of punky, and you don't want to get up out of bed in a car to the office where the sick people are, you have an opportunity now to actually have a doctor make a house call. It's not a fantasy any longer. Dr. Farzam, thank you for being here today.
Thank you for having me, T.
All right, I've got some questions for you, and we're going to make sure your microphone is up. Say hello again.
Hi, thank you for having me, T.
Well, there we go. Dr. Farzam, House Call Doctor, first of all, tell me a little bit about you, where you came from, a little bit about your background. Give me a thumbnail sketch of who you are.
So I've lived in Los Angeles for over 40 years. I'm a board-certified physician. I did my training at Tufts University in Boston and my residency training here at Cedars-Sinai in Los Angeles. And I'm the CEO and founder of House Call Doctor Los Angeles, where we've basically been operating a concierge house call practice where the physician comes to your home for over 10 years now.
Now, when I was growing up, there was a famous television program, Marcus Welby, MD, and he was that guy, and he came to your house, and this fell out of favor for a while.
It did. You know, once the insurance market changed and a lot of doctors became office-based only, the house calls, market just dropped by the wayside. Now I think the market is changing. House calls are definitely coming back. There's a lot more companies out there that are operating house call businesses for several reasons. Some people are sick and they can't leave the house. Some people just want privacy. Some people want the convenience and they don't want to sit in a doctor's office or an urgent care or an emergency room for a 3-4 hour wait sometimes.
It really is the idea of purgatory, or that other place, the opposite of heaven. If you had to picture in any film or any television program, where's the last place you really want to be? And I have to tell you, the anxiety sometimes, I know that we've heard about white coat anxiety. I don't know that it's so much we're afraid of the doctors or we're afraid of the medical professionals. There's something about that waiting in the waiting room, and so the idea that you've sort of just decided to take that away, for me, makes me incredibly happy, because that's one of the last places I want to be. So you've now eliminated that. When did it start to become in vogue again?
Probably in the last 5 years, and it's still an emerging market. I think over the next 10 years, we'll see a much bigger change as far as house calls taking over more of an office atmosphere. Every study that's been done shows that house calls save money to the healthcare system in general. It's much less expensive than an emergency room visit any way you look at it. And so insurance companies and Medicare are actually looking at this now and starting to pay physicians to do house calls because it actually saves the entire healthcare system dollars at the end of the day, and sometimes unnecessary tests and extra tests that aren't needed.
Right, and one of the other things I think I find in what I've seen about house calls is the idea that a lot of times when you're sick, if you call your doctor's office and you try to make an appointment, Well, that's not always an easy thing to do. House call doctors, what is your patient load like? Do you see the same number of patients? Do you find you kind of tailor it down a little bit?
It's definitely tailored down. Obviously, there's a drive time associated with it. So, office doctors in an office setting see on average 20 to 30 patients a day. And so the time they spend per patient is less. On average, it's about 7 minutes of face-to-face time with the patient. House calls, we spend as much time as the patient needs. So average visits are 20 to 30 minutes with the patient. But as I said, we really tailor it to them. There's no rush because we're not limited by having to see a certain number of people per day to make ends meet with an office staff and rent and everything else. So
a lot of the overhead costs, and you kind of cut out the middleman. And in addition to the idea that costs can be saved in this, I have to think that longer time with patients means ultimately better health care for the patient. And
100%. Yeah, I mean, it's any way you look at it, if particularly for house calls, I get to see a much better atmosphere. I come into the home, I see where they live, I see a different environment. You meet the family members, spending more time with them, you get to ask more questions and answer more questions, and so it's better care overall.
And in an office environment, the examination room is kind of small. You can't bring everybody in. And if it is a house, like say your mother lives with you, or you're an elder relative, like you don't always have a lot of people. Yet in the house, you can bring everybody in who's partly involved in the health care of the patient, because they can tell you. And I have to think too, other concerns that might not come into play, correct me if I'm wrong, would be also a consideration. You can probably discuss the patient's diet, or bring some things into the picture that might not be thought of in an exam room.
Yeah, no, definitely. And you actually learn more about the patient, seeing them there in their own natural environment where they're comfortable, they're in their own comfortable clothes. It's not a sterile environment in a small office. And as I said, they're actually more comfortable as well. So it actually eliminates a lot of the white coat syndrome.
That anxiety.
Yeah.
Now, you've done both, right? You've seen patients in a clinical setting in your career, and now the house call. I'm super curious how this has affected you as an individual, because as a doctor, you in an office, you don't have the chance to see patients as long, and you kind of have the clock. You have different stressors as a physician. How has this affected you as just Michael the guy? Have you found that it's
I'm biased because it's my profession, but I can say genuinely I think you get better care. Spending more time with the patients, I think diagnostically is better for the patient. Secondly, it gives more opportunity for follow-up. So, I have a policy. We call every patient within 48 hours when they're seen to see how they're doing and see if they have any follow-up questions or concerns or issues. An office doctor that's seeing 20, 30 people a day just cannot call patients back. So they just kind of wait and see if somebody isn't doing well. The patient's, responsible for calling back. And so I think the overall care is just...
So for the patient, but what about you as besides the doctor, but as the man? Do you find that it's a little less stress on you, or is the workload harder?
It's a different workload, and particularly because we do a lot of work after hours and weekends when the doctor's offices and urgent cares are closed. So from that standpoint, the workload is different. But I actually enjoy it. I think I'm not stressed. Having to see 4 or 5 patients an hour. I get to spend more time with the patients. It's an enjoyable atmosphere, even when they are sick.
It's probably easier to focus too, right? Because you're just thinking about that patient. You don't have in the back of your mind
people calling you and emailing you and at the same time, and so it is a lot more focused visit, and I think it's just better care overall.
It's better for the patient if the doctor's happy. It's that old adage, if mama ain't happy, ain't nobody happy. And if the doctor's not happy, it can't be, in your best interest. So
Yeah,
it
a
is.
lot of doctors are burnt out, unfortunately, in today's medical environment. Doctors who are seeing 20, 30 people a day, and they still have to round in the hospital and answer emails and return phone calls and call in prescriptions. It's a lot of work.
So it's not what we're seeing in pop culture. Have you seen some of your counterparts in the media? There's a fabulous television show I was introduced to called Royal Pains, where it's all about concierge doctors or the doctors that make the house calls or show up on movie sets. There's a USA network television show now, Rush, and then a novel called Crisis. This is all about a doctor practicing concierge medicine. So it's not that. So it's like when everyone thought that the ER docs were all what everyone saw on Thursday nights. It's like, no, it's not quite like that. But it is less stressful, and which makes me happy because honestly, I want the person who's taking care of my car to just focus on my car and not be distracted. I have to think, as you say, that the patient level of care is so far beyond what, doctors' offices have their place, but I think it's lovely that you have the opportunity. Now, let me ask one of the number one questions I've been asked since I've spoken about things like house call doctors and concierge doctors, and we'll get into what that is in just a moment. It's a little bit different. Does insurance cover if I go online to your website, Dr. Farzam, to housecalldrla.com, if I go there, call you in, have you come to me, is insurance play into this, or is this a private cost? And at the end of the day, how do you feel that affects the patient?
I think, unfortunately, right now, insurance is a little bit, behind the eight ball as far as they haven't caught up to the standards that are required. So they don't pay. They pay for house calls. They don't pay well enough to make it worthwhile for a physician to spend the time to drive to someone's house,
right,
and drive back. So what we do is we charge out of pocket. If the patients have any kind of PPO type of insurance, we give them a super bill invoice that they submit and get paid back a portion of the fee.
And from what I've seen, a lot of, we're going to talk a little bit about concierge medicine as a dovetail, because it's a little bit different, right? Mm-hmm. Concierge medicine is something that has been, it's like almost like a club would be the short way to say it. You buy into you pay a fee, and you are part of a group that the doctor will come. Most concierge doctors come to your house also, or do you go to an office?
I think it depends on the physician. Every doctor has different models. Concierge medicine as a general concept is really paying for more direct access to your physician. So it involves either paying monthly fees or an annual fee, and essentially it gives you 24/7 access to your doctor. You're guaranteed same-day visits. Most doctors give access to their personal cell phones, so that way there's just, you're.
And that's pretty unheard of.
It is unheard of. It's a little bit of a different burden on the physician, because as far as personal time, but people are paying for more direct access and better care to their physician directly. So it does cut out the middleman as far as insurance companies and bureaucracy and office staff. And
things have changed since the Affordable Health Care Act. A lot of things have changed, because I've spoken to a number of physicians and chief medical officers at hospitals, and we've all talked about the impact, how that a lot of doctors' offices are a little more crowded now, because people have they have access now to medical care where they didn't before. And with something like concierge, you're going to take away that crowded, because it's now a different playing field as far as the patient is concerned. But I've been surprised at how some people are talking about the office, the concierge medicine, or the doctor, the house call doctor. It's sort of a no frills version of your doctor's office, where you come, it's a little more of a streamlined process. And even if you're paying into insurance or you're paying into, it can be extremely expensive. And then you also have your deductible. And for some people, this makes sense because if they figure out how many times they're going to see a doctor or how many times, how many tests, like you talked about earlier, cutting out tests that are unnecessary, there's a number of studies being shown that this sort of pared down idea of medicine is, one, better for the patient, and for a lot of people, they're figuring out ways to make it work for their pocketbook, because a lot of, like you said, their insurance companies aren't quite behind this yet. They haven't. I think that's the next conversation to be had now. How do we take care of that? But eliminating insurance billing costs for doctors, I know this is cutting from one study, they were saying 40% of that practice overhead expense, and it helps you guys keep your fees low, and then the idea that you're negotiating differently with labs than a doctor's office, correct?
It is, yeah, and I would say that, concierge medicine shouldn't replace insurance, because it's obviously not going to cover, if you, God forbid, needed to be hospitalized, or if you need a
anything
catastrophic. But what it does is to the physician, it allows them to scale down their practice so they don't have to see 20, 30 people a day and spend the 7 minutes per patient, and give more individualized attention in the office. They spend more time with them per visit. The average, time is 30 to 40 minutes with a patient. So you get to not only address the chief complaint that the patient's coming in with if they have a cold or a cough, but you can actually address other things like preventative health, and are they exercising, and what's their diet like. And
that's amazing to me, the idea that with what you're doing, you have, in addition to dealing with the issue at hand, the idea that more preventative health care comes in, because for a lot of patients, maybe they're only going to come see their doctor when they have that one issue. And like you're saying, house call doctor or concierge doctor, this is a little more of a practice that's really, truly all about the patient. And you can customize what kind of health care they're getting at that point.
Yeah, it's more personalized care in general. I mean, when a doctor isn't rushed to have to see, 5 patients an hour, he has the time to be able to spend to really go over and go in more depth and detail as far as patients' wants and needs, and address some of the other concerns that they just physically cannot address in a 7-minute visit, when someone's coming in for a different complaint.
Now, as a house call doctor, again, housecalldoctorla.com, it's just that you come to the home, you come to the office, you come to the hotel. That was something that struck me. I've become ill a couple of times while traveling, and think to myself, wow, I really don't want to go now and find, a new doctor or go to an ER. That's also one of the benefits, is that having a house call business, you really truly can go wherever the person is in the moment, or what their schedule will allow.
Yeah, I mean, our service is 24/7, so we're usually at the door, seeing a patient within a couple hours of the call.
Because not everybody gets sick on banker's hours.
No.
And I used to get mad at my kids. It's like, really? It's a Friday night. Now you have to be sick.
Yeah.
There's no doctor in the office.
Yeah, and unfortunately, you're right. Doctors' offices are, 9 to 5, and
closed 12 to 2 for lunch.
And closed for lunch. And even urgent cares, believe it or not, in today's day and age, it's almost impossible to find a 24-hour urgent care.
It's not so urgent.
They're it's hard to staff, and it costs a lot of money to keep them open 24 hours.
Yes.
So a lot of people end up, for simple ailments, having to go to the emergency room when it's after hours and weekends. And 90% of things that come to the emergency room are common primary care issues that don't need to be in the emergency room, and so they cost the patient and the healthcare system a lot more.
A lot more money. And now, as a house call doctor, Dr. Farzam, do you see one thing more than another in your practice? If you had to put the straws on the table and, here's here are the issues I see most. Every now and then, here's the zebra and the pack of horses I see. For the most part, have you found that your calls are of a certain type, or Is it all over the board?
It's all over the board. I think we see everything a doctor's office or urgent care does. So, all the, the typical things, and, low back pain, stomach flus, urinary tract infections, colds and coughs. But we see everything from head to toe. So really anything a doctor's office or urgent care and most things an emergency room would see, we're able to do in the house now.
And things that don't need to be in the emergency room or sitting in a waiting room, it definitely kind of cuts that down.
Yeah, we're able to do all types of on-site testing, strep tests, urine tests, blood draws, X-rays and ultrasounds, and IV fluids. I mean, we can really do a lot of things in the home that people don't appreciate.
Again, we're talking with Dr. Michael Farzam, who's here with housecalldrla.com. When we come back, we're going to talk about telemedicine.